Good afternoon, good evening, guys, wherever you're watching me from. This afternoon's discussion D deals with occupational therapy for someone in a health crisis. So here we go with today's presentation. Let me put it together for you, and I'll be right with you. Give me 1 second, please. Okay, here we go. What occupational therapy involves. Now, I told you this is all helping someone go through a health crisis with occupational therapy. Occupational therapy involves supports individuals in gaining or regaining independence and quality of life. Focus areas: physical health, mental well-being, and performing daily living tasks. Emphasis: preserving identity and autonomy throughout health challenges. Supporting loved one in crisis. Common questions: how often to check in what to say, and when to step back. Empathy and boundaries. Loved ones often feel uncertain, but thoughtful support can be transformative. Education. Tufts Occupational Therapy program includes guidance on how to be helpful without overwhelming someone. Contextual stats. Disability prevalence. Over over 1 in 4 U.S. adults live with a disability. Rates rise with age. Chronic conditions. Around 42% of Americans manage 2 or more chronic health issues. Would you like to dive deeper into how this connects with memory friendly care or caregiving frameworks? Given your work, there's definitely a fertile ground to explore. Absolutely. Occupational therapy, OT, offers a nonsense and multifaceted approach to enhancing mental well being, especially during or after health crisis. Emotional and cognitive benefits, promotes identity and purpose. OT helps individuals reconnect with meaningful roles, whether that's a patient, worker, feelings, or artist, friend, which counteracts feelings of loss or aimlessness. Supports executive function. Therapists use cognitive strategies to improve memory, attention, and decision making, crucial for maintaining autonomy. Alleviates anxiety and depression through routine building, mindfulness, practices, and guided activity enhancement, engagement. OT reduces emotional distress and boosts mood stability, creating safe and empowering environments. Environmental modifications. Therapies as therapists assess and adapt living spaces to reduce stressors. Think noise reduction, many cues, or sensory friendly design. Sensory integration for individuals with trauma or neurological conditions. OT uses sensory based strategies to promote self regulation and comfort. Resilience through engagement by resilience through engagement by encouraging participation every day. tasks, even modified ones. OT fosters a sense of control and personal efficacy. Social and behavioral support, enhancing social skills. Group OT or one-on-one sessions can be built. Communication, empathy, and conflict resolution skills. Shared decision making. OT promotes collaborative care planning, empowering individuals to advocate for their needs. A key factor in psychological resilience. Behavior activation, especially effective in depression, effective in depression recovery, engaging clients in measurable goals. Directed activities can re-navigate motivation, given your expertise in memory-friendly design and concussion recovery. OT mental health dimension intersects beautifully with your trauma-informed care, neuroplasticity, and therapeutic housing environments. Would you like to explore how these approaches integrate into smart housing or frailty aware care models? I think you'd uncover powerful insights there. Occupational therapy. OT offers a highly tailored approach for individuals navigating specific mental health conditions using purposeful tailored approaches for individuals navigating specific mental health conditions using purposeful activities as both treatment and empowerment. Is how OT adapts to some key diagnosis. Depression, behavioral activation, encourages participation in meaningful routines, combating isolation. Okay. Depression, behavioral activation encourages participation in meaningful routines and combating isolation and inter criteria. Energy conservation and pricing helps clients manage fatigue and re-engage gradually. Cognitive restructuring reinforces positive self-image through successes in small achievable tasks. Anxiety disorder, mindfulness and grounding techniques. OT teaches calming rituals that can be incorporated into daily living. Sensory modulation uses tools like weighted blankets or textured objects to promote okay, sensory modif- sensory modulation uses tools like weighted blankets or textured objects to promote emotional regulations. Activity planning structures environments to reduce decision making fatigue and overwhelming sense. Schizophrenia and psychotic disorders. Social skills training focuses on program paragram par, paragrammatic communication, eye contact, and conflict resolution. Pragmatic communication, eye contact, and conflict resolution. ADLs, activities of daily living. Reintegration builds routines and self care strategies tailored to cognitive functions. Reality organization. Reality orientation and cognitive remediation supports attention sequencing and problem solving through structured tasks. PTSD and trauma related conditions. Trauma informed care. OT recognizes and avoids triggers while building trust based engagement. Sensory based intervention. Okay, techniques like deep pressure, rhythmic movement, or visual organization, calm hyperarousal. Self self-effectivency projects, activities that foster control, like gardening, or cooking, journaling, rebuild agency. Bipolar disorder, mood monitoring tools supports clients in recognizing patterns and planning accordingly. Routine management stabilizes circadian rhythms and sleep hygiene. Okay, and then we've got community navigation. Helps clients manage. Okay, helps clients manage transitions between manic and community navigation. helps clients manage transitions between um, manic. Okay, next page, guys. For you, there's a fascinating intersection here with your work on memory, friendly housing, and smart devices. Geriatric care. Imagine later layering these therapeutic strategies into ambient assisted living systems or designing micro based real time educational cues. Would you like to dive into how OT collaborates with CBT, dance therapy, or environmental psychology in these settings? Okay. Imagine layering these therapeutic strategies into ambient assisted living systems or designing microenvironments that modulate sensory input. Would you like to delve into how OT collaborates with CBT, dance therapy, or environmental psychology in these settings? The, uh, the, the occupational therapist is undergoing a tech uh, re, reassistance, and it is thrilling to see how innovation is reshaping care delivery and client empowerment. Here are some standout techniques that blend cutting edge technology with therapeutic. Virtual reality augmented. Virtual reality are AR used for intensive rehab environments, ideal for stroke recovery, PTSD, and cognitive training. Interactive um, methods enhances timing, attention, and motor coordination throughout rhythm-based exercises. Sensory modulation tools include weighted wearables, tactile devices, and smart lighting to regulate emotional states. Wearables and robotics, smart gloves and exoskeleton providers real-time feedback to refine motor and rehab and mobility training. Cognition specific devices like Apollo Neuro and for stress relief, or me go for post-stroke movement tracking. Robotic therapy systems, tools like Motus, Nova, and Hokamas Amelo supports active assist movement and rehab. Smart home integration, voice activated system enables clients with mobility challenges to control their environment. Adaptive tech includes one okay, ambient assisted living, or AAL, uses sensory and predictive algorithms to support autonomy and safety. Okay, guys, so that is it for D. I will see everybody tonight for a couple other shows. For now, Gator Wellness. Take care, folks.